Okay, today I want to talk to you about the SI joint or the sacro-iliac joint. So this is one of the major culprits in low back pain, especially if you feel your low back pain down closer to your butt and not as much up into your back. So first of all, what is the sacro-iliac joint? That is where your sacrum, the bottom of your spine, connects to your pelvis. So this happens by this spider web of ligaments that stretch is the wrong word there, that reach from the sacrum to the pelvis, okay? So the reason stretch is the wrong word is because ligaments are not supposed to stretch, okay? So basically, a ligament is a form of connective tissue inside your body. It connects bone to bone. Now, a ligament is supposed to either be tight, like this straight line, or it can come to slack. But it's never supposed to stretch beyond its means. There are certain times and certain injuries that might cause those ligaments to stretch a little bit, and that's where misalignment, pain, and a chronic situation can come in. Now, those ligaments will eventually go back to their size if they're worked with properly, but it takes a really long time and some effort, in particular working through the movement patterning that's allowing that ligament to stretch out. So in the sacro-iliac joint, you do have these small shifts of movement. So if the sacrum is kind of shaped like this, and then you've got the ligaments coming out to that big kind of heart-shaped pelvis, what you have are these little subtle shifts that can happen, right? Little tilts, little rotations. For a long time, people didn't even believe movement was possible there, but we're now, because of MRIs and we can look at the tissue, we're now realizing that it is possible, especially post-pregnancy or post any sort of abdominal surgery where the tissue had to get moved or stretched in some way. Post-pregnancy, because the pelvis has been stretched out, then when it starts to go back, and it may not ever go back to its pre-pregnancy size, which is fine, right? But when it starts to go back into its form, if the sacrum is just slightly tilted off, you then create a chronic problem inside the body. Things that can happen, low back pain. Sometimes people say they feel a twinge. That's like my favorite word that people say. They feel a twinge in their low back in certain movements. Sciatica can come from this, or you might get really tight in the hip flexors or in the piriformis muscles around the glutes because your body's trying to compensate and protect you. So the very best thing if you have an issue, or we call this a sacro-iliac or an SI joint dysfunction, the very best thing is to do alignment work, deep core with your breath, and glute work that gets the piriformis muscle out of the way. So if you think this is you, if you think you've got an issue with your SI joint, send me a message on Instagram at Julie Turner MVMT, on Twitter at Julie Movement, or send me an email, info@julieturnermovement.com. I'm happy to discuss this with you at any time.